So, a surgical strategy on when to switch to the microscope, the 10-minute rule. We can see attic disease in the attic and antrum here, and here we want to dissect for 10 minutes whilst we're making progress and we have clear planes. So we can see the edge of the cholesteatoma sac with granulation superior to the chorda. The incostapedial joint is divided, and then we can clearly see the sac anteriorly. This is dissected with a round knife. Underwater drilling is used to extend an adicotomy 2 to 3 millimeters. And we use the equator of the burr as well as the lateral aspect of the burr. And this allows us to advance and brush and not push the burr, but also to create a bevel in the adicotomy, which allows a more open access to the attic. Then a neuropad is used to clean the area so we can progress with direct visualization. And we're dissecting off the lateral aspect of the incus here and off the scutal medial aspect of the scutum. So here we can see with a short Thomason, a tear will occur soon with the dissection, which means we've breached the capsule. You can see here a tear has occurred. So you're using a cup forceps here and the tear is extended. This is still within the 10-minute rule, still under 10 minutes, and there seems to still be progress occurring here with the dissection. But we switch now as the tear enlarges to try and dissect with a short Thomason. So we can see the hole in the sac as well as disease on the incus, lateral to the incus. So a short Thomason is used to advance in a clockwise direction, dissecting off the incus and off the medial aspect of the scutum. And it seems to be coming off quite cleanly here, but then once again, a tear occurs in the sac. You can see that occurring here. So this is probably not going to be able to be removed endoscopically, but we'll keep trying within the 10 minutes. And we have a last stitch attempt with a medium Thomason. And once again, try and sweep to remove in toto the disease in one go. And it tears even more. So a decision is made to use the microscope and open up the mastoid. And we can see the antral disease just here. The incus is left in place so that we can use it as a guide for the mastoidectomy. Thanks for watching.